Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Our top story this week comes from JAMA, which announced results for patients with type 2 diabetes treated with high-dose liraglutide. The drug is marketed in the United States as Saxenda. Overweight patients taking the 3 milligram dose for 56 weeks lost 6% of their weight on average, or 14 pounds, while maintaining good glycemic control. A quarter of the patients lost more than 10% of their weight. The study's lead author, Dr. Melanie Davies, told AJMC that these findings could lead to better coverage for the drug in both the United States and in the United Kingdom, where the study was based. Payers, including CMS, have been slow to cover obesity therapies even though the American Medical Association declared obesity a disease in June of 2013. Medicaid managed care covers more beneficiaries each year as states look for ways to hold down costs. Iowa this week awarded contracts to 4 vendors for its $4.2 billion program, which will begin serving 560,000 residents in January. But as managed care has expanded in programs that serve the poor, it is now covering more clients that are hard to serve, including those receiving home care, children with severe disabilities, and those with life-threatening illnesses. Advocates for disabled children in California this week raised questions about a plan to move a special children's health care program to Medi-Cal, the state's Medicaid program. Earlier this year, the state auditor found that Medi-Cal already had too few providers, and that calls to the state consumer hotline went unanswered. Medicaid managed care regulations pending before CMS are expected to address how states must serve the most vulnerable patients, but those rules will not be final for months. Medication adherence differs from group to group, and healthcare delivery must adapt in response to what patients want. That's what Michael Evans, the director of Geisinger's Ambulatory Clinical Pharmacy Systems, told AJMC.com recently.
Which patient population are non-adherent to therapies or more likely not to be adherent to therapies? Examples of that are patients that have a low education status, patients that have not accepted their disease, do not understand the severity of their disease and the consequences of not managing the disease. I don't want to put a stigma saying that it's a low socioeconomic class. That's not always the case. We're finding that different generations want to be taken care of in a different way. So let me answer it this way, where patients such as the millennia population, they do not want to have scheduled appointments, nor do they want to come in for office visits. They want to be taken care of by their electronic device they carry around every day. So they want us to push information to them through the electronic device, and they also want to communicate to their health givers back into the electronic health record or secure text messaging, some electronic method to their healthcare providers. The middle generations are varied, and some of the middle generation are tech savvy, and they also want that IT connection to their medical team. Others still believe, and they've grown up with the face-to-face visit with their healthcare team. They do not even believe in a phone call follow-up.
Finally, one of this week's most popular contributor pieces comes from Dr. Katie Kozimanel, who writes about the rising popularity of doula services and the increased evidence that helped new mothers and infants avoid complication. According to the article on AJMC.com, doula services especially sought after by parents who work for health plans. Their influence may help get these services covered for everyone. You can read the article about doula services on AJMC.com. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.